All right, we are live. Hello, everyone. Happy Thursday, Friday Junior. And today we'll be doing a Facebook Live. This is the voice and the face of Dr. Tolo Labinto. And today we'll be talking about the topic understanding heart attacks, talks with an interventional cardiologist. If you are watching live with us, hashtag live. If you're watching on replay, hashtag replay. If you have friends who could benefit from this, go ahead and send them this link. Tag them in the comments. I'm so excited to be doing this with you. Give me 1 second. My guest is calling me, so let's see. Give me 1 second. Okay, so our guest is joining us. He just called, so we should be go on as shortly. So we're going to be talking about understanding heart attacks, talks with an interventional cardiologist. And as a family physician, you probably wonder, why am I talking about this? I'm talking about this because I want us to talk about interventions that happen, or what a heart attack is and why we want to prevent them. Yes, that's one, but we could talk about what happens during a heart attack, and we can also talk about why it's important to prevent them from happening. Okay. And so I'm excited. We're going to be talking to an interventional cardiologist. By the way, how are you doing? How you guys been doing? How's life? How you thriving this last quarter of the year 2023? It's hard to believe that this year will soon be over. But you're here, you're doing the do's, you're making moves to help improve your quality and quantity of life. I have a favor to ask. Please subscribe to this YouTube channel. If you're on Facebook, like and follow our page. That way you get notifications for when we go live. And also, if you're watching live, please hashtag live. If you're watching on replay, hashtag replay. All right. While I'm waiting for my guest to arrive, I'm going to talk briefly about him. He's actually local to us here in Mansfield. He's an interventional and structural cardiologist, and he has been doing this for a while, actually. And some of my patients have had to refer to him because of the nature of their medical condition. So I'm glad he does what he does. Hopefully he'll be joining us soon. Otherwise, we'll go ahead and start and talk about heart attacks and the like. All right. Let me see who's watching. All right. Give me 1 second. Let me see. Let me see if he's had any issues. Sometimes us doctors are not the most tech savvy people. All right. Give me 1 second. Let me see if we can get our guest on. Let me try one more time. Hang in there, okay? Grab a friend, grab some healthy veggie snacks, and sit tight, okay? All right. So at this time, I'm not able to hear from him. So let's see if he joins us. It looks like he's having some technical issues. So today we're talking about understanding a heart attack. So the first question I was going to ask him is, simple terms, what happens during a heart attack? Okay, and why is this not a good thing? So a heart, as many of you, well, some of you may know, some of you may not know, the heart is the only organ that actually pumps blood to itself. Think about it. So the heart is the organ that pumps blood. Think of it like a water reservoir. That's how I explain it to my patients. You have a big water reservoir that's sending water to, say, house, which is maybe the brain, which is the legs, the kidneys. It's sending blood to every organ. But the heart also sends blood to itself. So you can imagine the implication of a heart when there's a blockage to the heart, right? And that's essentially what happens with a heart attack. The heart is not able to send enough blood to itself. Now, I want us to understand the implication of this, because if the heart that's supposed to pump all this, let's say we talked about a water reservoir, supposed to send all these liquids or send all this blood that's carrying oxygen, and oxygen is the backbone, or is the building block for energy. Without oxygen, or without blood carrying the oxygen, you cannot survive. And so the heart is the only organ that actually self supplies itself. And so when it's a heart attack, the circulation to the heart is cut off. And so what happened? The muscle of the heart actually starts to die. When the muscle dies, it's not able to contract and pump the blood or send the water, like I used in the earlier analogy, to the rest of the heart or to the rest of the body. And that's why it's very, very important to prevent heart attacks. Okay. So that's essentially, in simple terms, what happens to the heart during a heart attack. Blood vessels. So the heart has quite a few blood vessels that send blood to itself so it can do what it does for everybody else. But for it to, or for every other organ, but for it to do what it does for every other organ, it has to supply itself. So it's very, very important to protect your one heart. Now, what are the common symptoms that occur or someone may experience during a heart attack? Now, this one varies on the person. Most people, or the most common symptoms: chest pain. Sometimes it could be tightness. Sometimes it could feel like an elephant sitting on your chest, like a pressure. And sometimes that pain can radiate to the hand. It can radiate to the jaw. It can radiate to the neck. That's the typical presentation. Now, I'm not a cardiologist, but I've witnessed quite a few heart attacks. I've been in the ER when patients have had one, and I've had to send some patients who were actively having one to the hospital. Now, sometimes in women it's a little bit different. It could be a little more vague. Patients who are diabetics too may not actually have the same typical symptoms. Sometimes some people present with shortness of breath. Some present with diaphoresis. That's where they're sweating, like, they're not running a marathon. They're not doing anything that's physically really demanding. They're just sitting still and they're sweating profusely. Okay. Some present with dizziness. But the typical side effects, you have the chest pain, it radiates. And sometimes people have the pressure on their chest, like that feeling of the elephant on their chest. These signs are red flags. And like I said, in women, sometimes they present a little differently. The breast tissue is there. And women, people who are diabetic too, they tend to present a little bit differently. But those are the typical symptoms of a heart attack. Now, what causes a heart attack to occur? The most common causes, believe it or not, is high blood pressure. High blood pressure is a common cause. There's some cardiac defects some people are born with or that occur over time, but high blood pressure is notorious for causing heart attacks. High cholesterol and diabetes. Those are the three ones, the three major contributors to heart attacks. And the truth of the matter is, these things can be prevented by taking precautionary measures. What does that mean? I don't want you to have a heart attack before you know to prevent another one. We want to prevent that from happening, because when muscle dies and a heart attack happens, sometimes, it's life-threatening, meaning some people don't survive. But a lot of times, as a cardiologist who have been here would have said, there are things that they can do to help almost like, what's the word? Reestablish blood flow through the pipes of the heart, or the blood vessels that send blood from the heart to the heart. So sometimes they put stents. What are stents? They're like little coils that they put, around or in the blood vessel, almost like creating the bridge between one side of the blood vessel to the other side, so blood can flow properly, or to open up the hole, or the blockage that has happened during a heart attack. Okay. Sometimes some people need to have open heart surgery because there's too much blockage in multiple vessels, and it is actually better to open the heart and go in and clean out the pipes the best that you can, and try to, I wish the cardiologist was here who'd tell you what he did, because I'm not in there in the OR. But essentially, they're trying to stabilize the heart and reestablish blood flow. But I'll be honest with you, it's not the same as the original, right? What your heart looks like the first time around. I'm glad we're in an era where there are options for those who have heart attacks. There are things that can be done to preserve function and to help people live long and well. But it is ideal for you not to get to that point. But for those of you who are watching who may say, well, doc, I understand. I'm already at that point. They already had a heart attack. There are things you could do to prevent another one. The risk actually goes high for another one if you've had one and you don't do anything different. Okay, so that's essentially what happens. So yes, cardiologists are there, interventional cardiologists are there to help reestablish blood flow. But I want to encourage you, let's not get to that point. So let's make sure blood pressure is controlled. Let's make sure your cholesterol is good. Let's make sure that diabetes is controlled if you're diabetic. Let's make sure that you're staying active once cleared by a cardiologist after a heart attack. Those are things that you could do to prevent another one. Okay. Next question I was going to ask him, what are complications that can arise during or after a heart attack? Now, we talked about the heart pumping blood, carrying oxygen to different organs. If there's a heart attack, then blood flow to organs are reduced. So there's a chance that there's what we call end organ damage. Okay. The heart can then get weaker. You can go into what we call heart failure, where the heart is not able to pump effectively anymore because the muscles around it. Think of it as like something like this that's pumping blood. All the muscles need to work together to send it out. But if one area of the heart has lost blood flow, then that area kind of dies, and so it's a little too weak to pump with the other muscles of the heart, right? So one part is a little floppy, and so the heart gets a little tired. Actually, sometimes a lot tired. So people are not able to exert themselves. Things you used to be able to do, like take long walks, not able to do, especially immediately after a heart attack. Okay, so those are things that can happen, or that can be caused depending on the severity of the heart attack. Okay. Now, what are the immediate steps? The next question I was going to ask him that should be taken if someone suspects that they are having a heart attack. If you have baby aspirin around, you want to take, if you have baby aspirin, you want to take up to maybe 3 or 4 of them right away. You want to call 911. You want to scream out for help, because the sooner someone gets help and interventions are done to preserve the heart, the higher the chance of the person surviving the heart attack. Okay, so if you suspect someone, usually the typical sign, someone clutches their heart or they put their hand to their chest like this. That's one of the classic signs of a heart attack. You want to make sure you call the emergency hotline. You call 911. I suspect someone's having a heart attack, and they should come get you, because the sooner you get to the hospital, the sooner they can place stents, the sooner they can do things and give you medicines to help open blood flow. Now, the sooner they can take one to the operating room to correct the blockage that's causing the heart attack. Okay. Now, as a family physician, one of the things that I tend to do is to, when I see a patient for the first time, I ask you, okay, what are risk factors, right? So let's talk risk factors here. I ask, has anybody had a heart attack in your house or in your family? Or is there a sibling? Is there a parent? Is there a pattern of heart attacks in the family? And some of my patients will say yes. My father, their father had one, or their mother had one. The next question is, what age? When someone has a heart attack, or there's a family history of someone with a heart attack at a younger age, then that person who's seen the doctor, who's seen me, I tell them, very, very important for us to minimize the risk to you. But I like to say something. Just because someone has a family history of heart attack, or there's someone in the family that has heart attack, doesn't mean you have it. Sometimes it's not the medical condition that's inherited, it's the habits that's inherited. So you do not necessarily live out the medical history that you come with. And I love to say that over and over again. So if you're here saying, oh my goodness, I've had family members who had heart attacks, I'm worried, my risk factor, I've had patients, I've worked with patients who have defied the odds, who because of that have decided to eat cleaner, eat more fresh fruits and vegetables, who decide to walk as opposed to drive everywhere, who drink water as the drink of choice, who cut out alcohol. Yes. And who said, you know what, I'm not going to live out my family's I'm not going to leave out my family's history. I'm going to change my trajectory by doing things different. All right. So please, if you're watching, I want to encourage you. You just because parents had heart attack does not mean you will have one. But what we're going to do is, with that information, say, what can I do? What can I unlearn from just being around such family members? And this is not, no, I'm not trying to make anyone feel bad here. I just want to encourage you. I have seen people defy the odds. I've seen people leave, just years. So it is possible, but you make the change. So be encouraged. I don't want you to have a heart attack. You're not going to have one by the grace of God, because you're going to do the things. I want to appreciate all of you who have stayed with me to watch this program. Our guest was not able to join. He did try, but it looks like he was having some technical issues, but we're already here. And so I'm glad to be having this conversation with you. I want to encourage you to please make the change for your health. Make the change for those who care about you and who you care about. Okay. It is possible to live a heart attack-free life by doing things that prevent them. Okay. I'll give also this before I wrap up here. There is, I think it was Bill Clinton. Yes, I think Bill Clinton has had 2 heart attacks, at least 2. And yeah, he's not my patient, so I can talk about him. I mean, no offense. Okay. So, and story is that he did not want to have another heart surgery. And so he opted to do what is called the Ornish diet. And what they do is, it's like it's an intensive program where they help with management of stress, blood pressure control. You're eating essentially plants, like a healthy whole grain diet. And he was able to reverse heart disease. I'm talking, he had blockages around his heart. He had, and he said, you know what, I don't want to do surgery. I want to try lifestyle modification. I need help. He had a whole team, and he was able to avoid another heart surgery, and his heart actually got stronger. It's amazing how much the body can forgive you when you do the things that encourage that growth or that reversal. The body, God is amazing. The body can be pretty forgiving, but it is very, very important to do the things, to learn the things that you could do even naturally. Now, I'm not saying when you, God forbid, someone has a heart attack and you say you're going to eat plants. No, you go to the hospital. You get the help, get yourself stabilized. And then there are lifestyle modifications in addition to medications. Don't get me wrong, but it is possible to reverse some of the damages based on what you do from that point on. So if there's anything you've learned here, I know you wanted to come and hear the mechanics of what it's like to have a heart attack, what happens. And, I'm going to have him come on. We're going to try this again, have him come talk about what happens and what he gets to do. Is really exciting stuff. I talked to him about this beforehand, and, that we talk about patient care. And so I was so excited, like, wow, he said there's new technology now that helps even speed up the process and minimize the risk of complications. So yes, all that's fine and dandy, but I don't want you to be, you don't have to be a participant in that. Okay. So please be encouraged. If there's anything that you take from this live or this conversation we're having, do the things to help prevent what we call end organ damage. Do the things to prevent a heart attack. Do the things to prevent a stroke. Stress management. I've had people have heart attacks just from heartbreak or just carrying on too much. It's easier to say, oh, don't stress, but being intentional about managing stress, deep breathing, thinking positively, practicing gratitude. Those things are actually linked to a reduced risk of heart attacks, believe it or not. And they're simple, sometimes a little woo-woo, but important nonetheless. Okay. I hope this has been helpful. I'll let you know when we're going to do this live for real. We'll have posts up and flyers up when we're going to do this again. But thank you all for watching. Please share this with someone who could find this useful, someone who could find this encouraging, to say, hey, I know the diagnosis is there. I know this is there, but don't give up hope. As long as you're alive, there's still hope. There are still options to help improve your quality and quantity of life, whether you've had a heart attack or not, and whether you have family history, even a strong one, of heart attacks. But do the things that help reduce that risk. It's been a pleasure hanging out with you this Thursday evening. Thank you for watching. Let me see if I can see Cynthia. Thank you for watching. I can't see those of you who are on YouTube, but thank you for watching. Share, as always, follow, subscribe, and I will see you in the next episode. And as always, if you or anyone is looking for a thorough, a compassionate, and a and a physician that will help you live long and well and have conversations to help. I am she. Thank you so much for watching, Cynthia. It's a pleasure to have you. All right. Bye, everyone. Have a good one.